In today's video, I'm going to walk you through insurance verification steps every virtual medical assistant should know, what information you need to check, some common mistakes to avoid, and how to document your findings professionally. And stay on to the end of this video because I'm going to give you a simple insurance verification workflow you can use when practicing this skill. So let's get into it. Welcome back to the channel. If you are new here, I am Ade, and on this channel, we talk about virtual medical assistant career, telehealth, remote healthcare jobs, digital healthcare skills, and practical strategies for healthcare professionals who want to work remotely. And today, we are talking about something that may sound complicated at first, which is insurance verification. But don't worry, I got you, okay? I'm going to break it down into simple steps and one important disclaimer before we continue. Insurance policies, payer requirements, and workflows vary by insurer, plan, healthcare organization, and location. So, as a virtual medical assistant, you are not guessing or promising a patient that a service will definitely be paid. Okay, your job is to verify the information available, document it accurately, and follow your employer's workflow. Okay, now let's talk about it. What is insurance verification? It's so simple. What exactly is insurance verification? Insurance verification is the process of checking a patient's insurance information to determine things such as whether the insurance is active, what type of plan the patient has, whether the provider participates with the plan, patient financial responsibility, benefits related to the planned service, whether referrals or authorization may be required. The goal is simple. We want the healthcare team to have accurate insurance information before the patient receives care, and this can help reduce claim problems, delays, billing surprises, and administrative error. So the first step you need to take is to collect your patient insurance information. The first step is making sure you have the correct insurance information. Depending on the organization workflow, you may need information such as the patient full name, the date of birth, the member ID, the group number when applicable, insurance company, that is the name of the insurance, the subscriber's name, the subscriber's relationship to the patient, effective day, if applicable, provider or payer contact information. This is where attention to detail comes extremely important because one incorrect digit in the member ID or maybe wrong spelling of the patient's name or wrong date of birth can result in an unsuccessful verification. So don't rush this step. Ensure to get the patient full details. Ensure to get their full name, and you can use alphabet to understand and to get the correct name. For instance, maybe a patient say, "Oh, my name is Smith." Okay, you can use S for sun, M for mango, A for apple. Do you understand? So that I can get this correct spelling. Because if you do not get it, of course, the insurance verification step will not be successful. So always verify the information you received before moving forward. After collecting all the necessary information, the next step for you to take is to access the patient insurance portal or contact the payer. Okay, your organization might have access to the portal. If you have access to the portal in your organization, you need to use all this information you collected from this patient, log into the portal, put in the patient's name, their ID, the date of birth, and then access this portal. Okay, and if you don't have access to the portal, of course, you are going to contact the payer, call their number. Your hospital, your clinic is going to give you the insurance phone number. So you're going to put a phone call to them, introduce yourself as a veterinary medical assistant working with social clinic, and ask that you are here to do what, to verify and check this patient verification, that you want to check the patient insurance verification. Of course, they are going to respond to you and they are going to tell you all the information you need. So after accessing the insurance portal or contacting the payer either by phone call or by faxing or by emailing, We have various means whereby you can contact the payer, but the fastest, of course, is for you to call them on phone. Other times you can send an email, or you can fax them. Okay, so after doing that, you want to check the eligibility. That is the next step. Okay, because this is one of the most important parts after collecting all the patient information. Eligibility, we want to determine whether this patient coverage is currently active or not. Okay, depending on the payer system, you may see information such as active, inactive, or terminated. Active means that this patient is currently active with this insurance company. Okay, that means they are still with them. Inactive means they might be with them, but they are not active. They've not paid their due for that particular uh, month. Okay, terminated means this patient is not what is not currently using this insurance. Okay, that's the meaning of terminated. Okay, so or you can see coverage information that requires additional clarification. And here is an important lesson: active insurance does not automatically mean every service is covered. Hmm? Let me say that again. Active insurance does not automatically mean every service is covered. Because a patient is active, because you saw on the dashboard that this patient is active, does not mean that the service this patient intend to have is covered. And that is a mistake beginners sometimes make. Eligibility tells you that coverage exists under the plan. It does not necessarily mean that a particular procedure, provider, or service will be paid. That is why we continue verifying. Okay, because you have active on the patient dashboard does not mean that MRI is covered for that patient. So let's move on to the next step, which is identify the plan type. When it comes to insurance, we have different types of plan type. So depending on the insurance system, you may encounter different types of plan and product. For example, we have HMO, we have PPO, we have EPO, we have Medicare, we have Medicaid, we have employer sponsored plans. Okay, the specific details vary by plan. Why does this matter? Because the plan type can affect things like providers network, referrals, authorization requirement, and patient responsibility. There are some plans whereby if the patient doesn't have a referral, the patient won't be attended to. Okay, and there are some plans whereby they always need authorization requirement like prior authorization. Do you understand? So as a virtual medical assistant, you don't need to memorize every insurance plan in existence. You need to understand how to find the information and follow your organization's workflow. All the information you need, of course, is always on the insurance portal, is always on the plan type. Okay, the next step now is to verify the provider's network status. When we talk about providers network status is also important. In fact, when it comes to insurance verification, all the steps are what extremely important, because if you miss one, it might lead to what claim issue, billing issue. Okay, so now in this particular step, you want to ask yourself, is this healthcare provider in network with the patient insurance? This can affect the patient's financial responsibility and how the claim is processed. If the patient is in network with the healthcare provider, of course, that is cool. But if it is out of network, then their financial responsibility is going to be different. Maybe the patient that is meant to pay just $50 for a particular procedure, if the network, if the healthcare provider is not in network or not in par, the patient financial responsibility may be higher. Instead of paying $50, they may end up paying times two or even times three. Okay, so depending on the payer and the plan, you may need to verify whether the physician is a network, the facility is a network, the service location is also in network. You want to make sure that this healthcare provider is in network with the patient insurance. Okay, and don't assume that a hospital or clinic are always in network with a particular insurance. Always verify according to the payer's process. This is one of those details that can make a huge difference. Once you're done with that step, The next thing you want to do is to check the benefit for the planned service. Now we need to ask, what service is the patient actually coming in for? This is important because insurance benefits can vary depending on the service. For example, the patient will be scheduled for a primary care visit, maybe a specialist consultation, a diagnostic testing, a physical therapy, chiropractic care, surgery, mental health services, preventive care. You need to check the benefits relevant to the service being provided. This is why insurance verification isn't simply is the insurance active. Trust me, is much more detailed than that. Okay, and I hope you are following the steps. The next step you want to take is to check the patient financial responsibility, which is checking copay, co-insurance, and deductible. And of course, when you encounter terms like copay, co-insurance, co-deductible, what is copay? Copay is a fixed amount the patient may owe for a covered services. Okay, co-insurance is a percentage of the allowed amounts that the patient may be responsible for after applicable plan requirement. Okay, deductible is the amount the patients need to pay toward covered services before the plan begins paying according to its benefits. You may also want to check the deductible amount, the deductible remaining, out of pocket maximum, out of pocket amount remaining. But remember, don't interpret benefit beyond your role or promise a specific final bill unless your employer's workflow authorize you to do so. The information you are seeing on the dashboard is used to support accurate administrative processing. So always stick to that. Okay, so the next step is for you is to check for referral or prior authorization requirement. Okay, and of course this is another major step because there are some services that may require referral or prior authorization. These are not the same thing. What is a referral? A referral generally involves a healthcare provider directing a patient to another provider or service, while a prior authorization is a payer's process for determining whether certain services or treatment require approval before they are provided. And as a virtual medical assistant, you may be responsible for identifying that a requirement exists and then following the organization's process for obtaining the necessary documentation or authorization. Don't guess, don't assume, always verify. Now, for prior authorization is not applicable for all services, like I said. Okay, it's for certain services. Maybe this patient needs to go for MRI. Okay, MRI means magnetic resonance imaging. And if a patient wants to go for that, the insurance policy may state that you need a prior authorization request, like you should request for a prior authorization before this patient can go ahead for the MRI procedure. And trust me, if you don't request for that, if you don't request for that prior authorization, the insurance is not going to accept the claim. Okay, so please always do your prior authorization if it is required by the insurance. Now let's move to the next step, which is record or document the verification details. Of course, this is where many beginners underestimate the importance of documentation. So after verifying the insurance, always ensure to document the information according to your employer's systems and policy. On the patient chart, you may need to record the date of verification, time of verification where required, the payer, eligibility status, the plan information, network status, relevant benefit, the patient's responsibility information, that is their copay, their deductible, the co-insurance. If there is referral requirement, you have to do that. If there is authorization or authorization requirement, you also have to do that. Okay, and you can always document the reference number. Most of these insurance companies, each time you call them, they always give a reference or confirmation number. The name of the representative contacted if applicable, and any follow-up required. The exact documentation requirement will depend on the organization, but your goal should always be that another member of the healthcare team should be able to understand what you verified and what needs to happen next. The final step for you is to follow up on discrepancies. Okay, maybe the insurance is inactive, or the patient's name doesn't match, maybe the provider is out of network, or maybe authorization is required, or maybe the payer portal isn't returning enough information. Whatever the issue is, follow your organization escalation process. That could involve contacting the patient, contacting the payer, notifying the billing team, contacting the provider's office, or escalating to a supervisor. So these are the steps you need to follow when it comes to insurance verification. Now, let me give you a simple workflow you can memorize. Okay, I'm going to use my Canva to design this, and I'm going to add it here. And you can have your pen to write it down. The first thing you need to do is what? Patient information, verify their identity, collect all necessary information. The next step is to do what? Check their eligibility, then identify their plan, then check their what? Their network, then check their benefits, check patient responsibility, check referral or prior authorization, document, follow up, and or escalate. Okay, so that is the basic workflow. If you can understand this process and practice it correctly, you are adding a very valuable skill to your virtual medical assistant toolkit. And trust me, a lot of hospitals, clinics are looking for virtual medical assistants that understand how the insurance verification works, because this is where they make their money from. Okay, if there's an issue with the insurance verification, it's going to lead to what? Loss of revenue. All right, so if you found this video helpful, like the video and subscribe, because we are building a channel specifically for healthcare professionals who want to understand remote healthcare careers and develop the skills employers are looking for. And of course, here is my question for you today. Have you ever worked with health insurance verification before? Comment yes if you have, and if you've never done that before, comment learning. I want to know where everyone is on their journey. And if you want more practical VMA training videos like this one, make sure you are subscribed. I will see you in the next video. Bye.